So guys, welcome all again, just a continuation of the previous session. I am Dr. Ankit Khandelwal, MBBS MS Anatomy Educator. We were discussing the important topics in anatomy. In the previous session, we have seen about the head, neck and the neuro part. In this session, we will talk of other important parts, the limbs and the trunk part. Let's start the session. Few important updates. PG 23 batch started on 30 September, FMG batch 16 September, QBank 2, check it out please. And a lot of discounts going on till September 30th, so utilize it. A lot of discounts plus an iconic. What is the current price, what is you got to pay, and how much you can save. So important update over here. Let's start with the upper limb now. Upper limb, limbs, remember again applied part. So limbs you see more in surgery or in orthopedics. I would say that we see more in orthopedics, because fractures, soft tissue injury, nerve injuries, vascular injury, that you can say in vascular injury. So this is what in upper limb and lower limb injuries are more, because these are the locomotive areas of our body. Therefore, little bit of osteology would help us in understanding the limb part. Just a second. Yeah. Okay, osteology, just a brief idea of the important bones, clavicle, scapula, humerus and carpals. Yes, carpals. Nowadays, a lot of things are asked about the age, forensic, which carpals start to fuse when does it start to appear, which is the last one to fuse, important. Right. Then after going from the bones part, we come to the main muscles. So there are many muscles. I just chalked out 4 or 5 muscles over here. But first go through these muscles, questions may come from them. Muscles, any muscle can come. Not a small muscle, but any relevant big muscle can come. So these are quite big. Pectorals, deltoid, trapezius, latissimus dorsi, serratus anterior, these are very important. Now, muscles like these is what you need to see. What you should see in muscles? Identify the muscles first of all. Which is this muscle? You should identify major muscle. That is what you should do. There is no escape from there. Then imagine when the muscle contract, what will it do? So what is the action of this muscle? Third thing, normally see, we also read in medicine and Harrison that myopathies are less common, the neuropathies are more common. So muscle injuries are less common, but nerve injuries are more common. That would lead to paralysis of the muscle. So you should know that not just these, but main muscles are supplied by which nerve. That is what we should know. Clear? So attachments, nerve supply actions is what we should be knowing about the important muscles over here. Breast or mammary gland. Again, we all know that most common carcinoma in females, not just in India but in worldwide. A lot of things are said in surgery about the mammary gland. So basically it's embryology, it's basic anatomy, it's a lymphatic drainage is what we should be clear with in the anatomy part. There is no escape from here, right? So lymphatic drainage mainly for the CA, carcinoma breast, surgical anatomy, breast carcinoma, TNM staging and all that we do in medicine, but you should read surgery and anatomy simultaneously, right? Particularly in topics like these, mammary gland or breast. Embryology is also very important. Next we come to the nerve injuries. Again, as I told you, from starting from brachial plexus, the Aus Felsi, the Column-Case Felsi, starting from there, each major nerve coming from the brachial plexus can be injured in any of the injuries. So we should know about the major terminal nerves and what happens if the nerve is injured. For example, many things are there. Wrist drop is there, pointing index is there. There is this clawing of hand is there. There's so many hands, so benediction hand is there. So many things are there. Ulnar paradox is there. You name it and they have it. So upper limb, lower limb, mainly in upper limb, the nerves and nerve injuries are very important for us to understand, right? So please, nerve injuries is very common. Again, this topic you may see in one of my previous special classes. Nerve injuries of upper limb as well as the lower limb. If you want a quick revision, then go through it. Next, major vessels and collaterals. Again, as I told you that nerves can be injured as well as vessels. Penetrating injury, anything like that. We should know the collaterals also. Because once, suppose you are in casualty or operating on the upper limb, there is a compound injury, compound wound, everything is opened up, the bone is opened up, you are operating onto it or simply dressing on a wound. You should know this is a artery, what the location of the artery, and if it is or its branches are injured, where should you ligate? You should ligate it here or not? Does it has any collaterals before the ligature or not? Suppose you are ligating an artery anywhere and there is no collateral just proximal to it, then the upper limb is going to be at risk, obviously. So you should know about the collaterals also. Collaterals are found in the scapular region, in the elbow region, even in the shoulder region, in the hand regions. Collaterals are everywhere, just like in the lower limb. Wherever we have a major movement of a joint, collaterals are there. Remember that part. So arteries and anastomosis, that is collaterals. Brachial artery branches, we should know, obviously. Shoulder joint, one of the most common joints to be dislocated. Shoulder joint, we all know about it. So basic anatomy of the shoulder joint should be clear. What is shoulder impingement? What is rotator cuff injury? What is a frozen shoulder? What movements you are going to test, like external rotation, internal rotation? And see, when you are studying orthopedics also, no, the basic anatomy osteology should be there. Then only will be able to understand the orthopedics. And also which X-ray view you are going to take, that should also be clear. So unless and until you know about the shoulder joint, okay, and with it comes the rotator cuff, the four muscles, SITS muscles. Again, muscles, identify them, action, nerve supply, movements and dislocation, obviously that we already know. How to reduce the dislocation, yes or no? Recently I saw a video, our Indian cricket captain Mr. Rohit Sharma, he had some shoulder dislocate, I guess, on the field, and he reduced it right on the field. So there's some small clipping of that which I saw. So see, if he can do, then we should at least be knowing, and it is very, very commonly dislocated joint. Right. Then comes the wrist and hand region again. We have moved out from this forearm and arm because we know there's muscles, nerves over here that we should be knowing, and there are a lot of cadaveric images in my sessions also that you can take help of it. Now come to the wrist and palm region. Again, this is a very small and very important topic, anatomical snuff box. Structures around the front and back of wrist again, over here and here. Why? You are in casualty, but there will be cases, suicidal attempts will be there. You should know that if a person has cut his front of wrist over here, then what are the things that could have been injured apart from radial artery? Radial artery is quite a deep artery. Before radial artery gets injured, there are other things that could be injured. So you should know about it. Palmar spaces, okay, extensor expansion over here. Lot of orthopedics also, you will see a lot of fingers, jersey finger, this finger, that finger. A lot of anomalies over here. And also, yes, recently we had an integrated session with our orthopedics faculty. You can have a look at that also. There are a few finger and these pathologies that were discussed in that session. Hand muscle identification, the small muscles, important muscles are there. Now a few images. You can see the osteo of the hand. Then humerus over here, important nerves which are related to the humerus, that is shown over here. Then we have this brachial plexus. This is another important topic, clavi, pectoral, fascia, structures piercing it. Please remember this. Four structures, mnemonic is called CALL. Then we have this artery, axillary artery, and you can visualize a lot of branches of it, and this artery is divided by the pectoralis minor muscle into first, second and the third part. Just branches over here. One of the important collaterals nowadays asked is collaterals or anastomosis around the elbow region. This elbow region, that is humerus, radius and ulna. Then we have this structures in front of the wrist. You can see the radial arteries over here, and a lot of tendons and nerves apart from it. Okay, you can understand the question recently in INACT also question came from here. I guess the arrow was marked at the ulnar nerve. There was a question, palmar spaces, and this is the bursa over here, but in the palm region you have the palmar spaces also. There is a radial bursa, remember FPL tendon. There is ulnar bursa, FDP, FDL, FDP, FDS, continuing into the little finger. These fingers, they are not continuous with the bursa, therefore these fingers can be used for pinpricking and all. Then movements of the thumb and hand movements are there, which we should know. This is a brief idea over here. Lastly, we can see a arterial. Again, the palmar arches, continuation of radial and ulnar artery. Radial and the ulnar artery. Next, we come to the thorax part, some important topics from here. Thoracic cage and wall. Thoracic cage, a lot of joints over here. Remember joints. ribs, vertebrae, sternum, cartilage, they make a lot of joints over here. You should know which is which type of joint because that has come in the recent exam. The thoracic cage and wall should be knowing, intercostal muscles, costal groove, arterial supply should be clear. Arterial supply both anterior posterior intercostal arteries. Same as we talk of posterior intercostal artery, come to posterior intercostal veins. Now in the posterior intercostal veins, it is the azygous vein which is the main feature over here. So how it is formed and what are the different veins which will combine to form the azygous vein is what is asked. Next we come to the mediastinum and divisions. Again mediastinum, I am sure some of the students, not many but yeah, 40-50% we can say, or 30-40%, even now confused about the mediastinum. How do we divide mediastinum? What is the meaning of mediastinum? How to study mediastinum? So this topic is important. And we all know, and therefore examiner also knows, that mediastinum is not a very easily taken up topic. So questions can come from here, right? And also mediastinum important in radiological anatomy also. So that was also we should know. Contents of each mediastinum, continuation. So what is this continuation superiorly? There is an infection in the neck or the cervical vertebrae on the base of the skull or even in the face below the mandible. And that infection, that was may trickle down into the mediastinum. Because there is no diaphragm over here. Like separating thorax and abdomen, there is nothing over here. So neck spaces, the deep cervical fascia spaces, they continue down into the mediastinum. That is what you should be knowing, right? So that is a very, very important surgical aspect having an anatomical relevance. Simple as that. Heart and lungs, needless to say, everything in heart and lungs is starting from their embryology development. Starting from the embryology, every part in coronary vessels. Why MI? Root of lungs, commonly asked. Histology again, heart, lungs. Not much in heart, but in lungs it is very much important. How to differentiate bronchus from bronchiole, bronchial from terminal bronchiole, from alveoli, from trachea. This differentiation should be clear in histology. Should be clear. Which will have cartilage, from where the cartilage ends, where you see a C-shaped ring cartilage, where do you see cartilage plates, where you don't see cartilage, and where do you see a complete layer of smooth muscles around it. These are the things in histology that can be asked over here. So heart and lungs, everything is important, plus last not least, surface marking over here. So what do we do? Penetrating wounds, you need surface marking, guys. There is penetrating wound over here, how much centimeter from the intercostal spaces, from the sternum, which intercostal space, you should know. When there are fissures in the lungs, horizontal and oblique fissure, you should know their surface marking. There is upper lobe, middle lobe and the posterior lobe or lower lobe should be clear. Heart, which chamber is where? Surface marking of these two vital organs is of utmost importance. Why? Because see, there are mainly 3-4 vital organs. Vital organs means any damage in this and the life is at risk. See, brain is the main organ, but that is inside the skull. So only there is a very high speed wound or injury, only that will damage the brain. Plus it is inside the skull, so there is no use of much of surface marking over here. But these heart and lungs, they are between the ribs. You can actually go through them, reach them. You do a tapping over there, you do pericardiocentesis. So you should know the surface marking, very important. Then diaphragm, between the thorax and the abdomen, that bigger diaphragm. Major openings, right from this embryology also, there are 4 parts in embryology. Major minor openings, both of them, and also as well as the applied part of this is important, of the diaphragm. Diaphragm functionally very important. The whole respiration is based on this only. Just a second, guys. The whole respiration is based on this only, right? So diaphragm function is also very important, right? Major, minor openings, all of them. Then you would realize the use of it, like from where the aorta comes down, what passes along with the aorta, where the esophagus comes down, hiatus hernia is there, where the IVC is going into, relation of IVC with the liver and the diaphragm. Very, very important things are there. So diaphragm topic, esophagus thoracic duct is small but important. RT tube, Riles tube, RT, esophagus, you should know the anatomy of it. Esophageal carcinoma, where are the constrictions in esophagus. Esophagus, what is the arterial supply? Some people confuse that it is a segmental origin also. No, it has not segmental origin. The arteries are segmental. There is cervical part esophagus, the thoracic part and abdominal part of esophagus. Different arterial supply, different venous drainage. Portovenous anastomosis. Course of thoracic duct, you should know about it. The most important lymphatic duct in the whole body is thoracic duct, chylurea, right? A few images over it. This is just the thoracic, this whole vertebral column showing different views. That is the zygous system that we are referring to. Few years back, it was a hot topic. It doesn't mean that nowadays they can't ask it, but yeah, 4 or 5 years back, it was a very, very hot topic. Mediastinum divisions should be crystal clear. This is just a transverse section through the superior mediastinum. This mediastinum, sorry, we have taken a transverse section. This is a picture that comes. Then just few vessels over here, the arch of aorta, and you can see the branches, arteriograms. Nowadays, see, radiological anatomy, surgical anatomy, orthopedic anatomy, ENT anatomy, these are the things that will be coming. Heart, posterior, pericardial sinuses, diaphragm with all the openings over here, constriction of esophagus, that is important over here and here. Yeah, this is a normal diagram, that is the constrictions. Now come to the abdomen part, right? So we've seen the upper limb, thorax, and let us now see some of the abdominal. Again, important topic, big topic. Abdomen, I am sure that people normally confuse in the peritoneal cavities, the spaces. Again, I would urge you to go through YouTube sessions, you may see over there, and in some of my special classes also, you will see important aspects of it. Let us see some topics over there. Important topics, your checklist point. Starting with the abdominal wall and the inguinal canal. Needless to say, there are 90% chances always that there would be a question from the inguinal hernia. Right? So, inguinal hernia is the basic of inguinal canal anatomy should be clear. Anti-abdominal wall, rectus sheath, right? All the muscles over here, that should be clear. Then from there, lesser sac, very again important. Why lesser sac at epiploic foramen? It is joining lesser to the greater sac. Its positioning is very important. Very, very important. Pringle's maneuver is important. What are the relations around the foramen of Winslow or epiploic foramen? That is important, right? Peritoneal spaces, I told you. Greater sac, lesser sac, hepatorenal pouch. Which organs are intraperitoneal? Which organs are retroperitoneal? Which are primary, secondary? Things should be crystal clear in abdomen. Abdomen basically, couple of things. We should know the peritoneum embryology. How do they start? Which organs are retroperitoneal? And where are the organs placed? What is the relation to each other? That is important. Suppose you open up the abdomen, your idea should be clear as a doctor, as a MBBS doctor. That is what they are going to ask you in PG exams. Once you open up the abdomen, what are the structures that you are going to see first? If you lift those structures, what are the other structures that you are going to see behind them? The sequencing should be clear. If the sequencing is clear, the rest becomes very easy, right? This is a structure, abdominal aorta, which lies most posteriorly. It is primary retroperitoneal. Obviously, tridentate and various branches, and comes AAA, abdominal aortic aneurysms, a lot of applied aspect from there, a lot of aberrant and accessory vessels that may come from here, a lot of things around the abdominal aorta. And when you look at the abdominal aorta, it should be clear that it is surrounded by lymph nodes and the nerves, plexuses, right? That should be clear to your mind. Post-abdominal wall, again, have a look at this session, the YouTube or the special classes. Post-abdominal wall. Psoas major, last year question came, psoas abscess. Back pain, swelling in the inguinal region, psoas abscess. Post-abdominal wall, that was the question. Lumbar plexus present over here only, that is the question. So post-abdominal wall is an important topic, and lumbar plexus, see, here it comes. L1, L2, L3, L4, those nerves, right? Apart from that, this is a very small, only 2 words are written, visceral relations. But that is the crux of abdomen. You should know which organ is placed around which organ. Duodenum is related to which kidney? What is present in front of kidney? What? Okay. I hope it is clear now. Yeah. So relations are very important. We'll see some images also. Each organ, say stomach, say take liver, any organ. Now relations you don't need to mug up. You simply need to understand that, okay, this organ is over here, what is present behind it. Now why is that important? 2 things. One, suppose a patient comes to you with pancreatitis. You are reading medicine or surgery, pancreatitis. It's a chronic case of pancreatitis and the infection or the hemorrhage is spreading out. If you don't know the anatomy or the visceral relations, then how will you understand that if the pancreatitis spreads out, what areas, what organs will it involve? Simple as that. Secondly, one is this applied aspect in the examination part, and second is when you are doing a surgery. Obviously, when doing a surgery and you are reaching towards an organ, it is not like that you open up an organ or you do a laparoscopy, you directly your laparoscope sees the organ directly. It is not like that. Even a small operations like gallbladder can be very tricky at times. We have seen deaths in gallbladder operations. So when you're doing a surgery or when understanding the clinical presentation of a case, the relation is very important. That is the point, right? Not just examination, but in understanding the clinical presentation of a particular case, the relations in abdomen are very, very important. Next we see the liver pancreas, again segments of liver, right? Segmental anatomy, the relations again as I was discussing with you. Ligaments are there. Now these are different from the bone ligaments. These are ligaments are double layered fold of peritoneum over here, like gastrosplenic, lienorenal, this sort of ligament. Thoracolumbar fascia, upcoming topic. This is a fascia which you will see basically in the posterior abdominal wall. It covers the quadratus lumborum and the erector spinae muscle. That is the thoracolumbar fascia. It continues upward into thorax also. It continues upwards into thorax also, right? Just a second. Yeah. Now we come down, kidney ureter. Very important topic. Kidney anatomy. See, there is a whole branch of nephrology. So, needless to say how important it is. Ureter course and relations plus ureter constrictions. Here, stones, sympathetic supply. Where is the pain referred to? Kidney, applied right from its embryology. Kidney, lot of right from horseshoe kidney to ectopic kidney to unilateral agenesis. A lot of things in kidney. Where to start, where to end. But this topic should be crystal clear. See, it is not anatomy that you are reading. Now, once you crystal clear the topic of kidney, it will help you in surgery, in medicine, a lot of things. So, it is a big bonus. Then pelvic diaphragm. Now, this is important. Why? I will show you the image also of it. But see, pelvic diaphragm you normally will not read anywhere else apart from anatomy and maybe obs gynae. It is basically a diaphragm which is present between the pelvis and the perineum. So, above you have thoracoabdominal diaphragm, below you have a pelvic diaphragm. The whole abdomen pelvis is between them only. So, it is like a closed chamber, and once they contract, they increase the intra-abdominal pressure and all. So, that you will understand as we proceed. Coming to the pelvic structures, there are a lot of organs: uterus, ovary, pectinate line, anal canal, urethra. Each organ has a lot and lot of applied part. So, either you study now, you will study later on when you open up the OBG or the surgery books. So, better is to correlate them. And few lectures you can see in the previous sessions. Perineal pouches, ischoanal fossa. Again, abscesses are so common over here. In the ischoanal fossa, perineal pouches also, injuries are common over here. The urethral rupture is common in male. So, these are things that we can focus over. A few figures over here, just showing you anti-abdominal wall and some dilated veins over here. Then this is the epiploic foramen. This is the epiploic foramen over here. This is the cadaveric image. What is it showing you? It is showing us this is the liver over here. That is the stomach and the duodenum, and that is the less omentum. This is the epiploic foramen basically. That is what is being trying to show over. That is the greater omentum over here. This is the epiploic foramen. So inside you have the less sac. This whole is the greater sac. Just an image over here. Liver, you can see relations. Duodenum, pancreas, right kidney, left kidney, aorta, IVC, ascending colon, and the transverse colon. Stomach, liver are intraperitoneal, they have been removed, they are in front of it. What we are seeing right now, most of them are retroperitoneal structures. Okay, relations important. That, what is that? I hope try to figure it out. It's a posterior view of a male bladder. Having the, what are these? These are seminal vesicles. There is a vast difference coming over here. That is cut part of prostate gland. Okay, posterior view of the male bladder. What will be lying in behind it? This is a rectovesical pouch of peritoneum. The rectum is lying behind it. Okay. So, PR examination, we figure out and we can palpate the prostate and all, understand that part. This is for the female aspect, the uterus, the tube and the ovary. Okay. And these are the pouches of peritoneum. Behind you have the, what is behind the uterus? Again, rectum. So, rectovesical or rectouterine fold of peritoneum. In front, utrovesical fold of peritoneum. Fallopian tube and the ovary behind. Right, it's just a few images showing you pelvic and diaphragm. This is the pelvic diaphragm over here. So all the pelvis organs, viscera placed over it. This is a perineal pouches. This is a thoracolumbar fascia. I told you it covers mainly two muscles, the quadratus lumborum and the erector spinae. The psoas has its own fascia. Psoas fascia, psoas sheath. Now let's wrap up the lower limb also, right? Again, lower limb is quite similar to the upper limb. Like injuries and the bone and all these are commonly involved over here also. So again, start with the osteology of it. Femur, tibia, tarsals again. They have asked a lot of carpals. Let me tell you, tarsals, my gut feeling, are coming in the next exam. Should be there. Gut feeling. Okay. So nerves and vessels again. For understanding these nerve and vessels, I would ask you to just devote your 10 minutes to the lumbar and the sacral plexus. And you can see your classes over there. Here you will understand the origin of all these nerves. Things become more, there is more clarity then. Simple as that. I mean, you can read it like this also, the sciatic nerve coming down like this, fine. But just give 10 minutes to this. You will develop more clarity, how the nerve is coming down. The thing should be crystal clear. I want you to practice the MCQs and all with a genuine interest. So that even if you are studying for 10 hours, or 12 hours, or 14 hours a day, it should be enjoyable. It should not be stress. That is what my motto over here is. So nerve and vessels, again anastomosis are a lot of there. Plus in lower limb, focus more on the venous drainage because against gravity it is going. Varicosities and other chronic venous insufficiency, deep venous thrombosis. So many things are there. Important topics, both of them. Femoral triangle and the erector canal. Surgically, anatomically very important. Femoral hernias are there. Femoral triangle is there. Erector canal boundary, psoas major. See, it is written separately. I have written separately over here. It is important, right? Next we come to what? The muscles. Major muscles. All major muscles. Glutes are important. Then posterior part of the leg, that is the calf area, that is important. Muscles of sole of foot. Go to any of my videos, you will find a trick to remember all the 4 layers of muscles in the sole of foot, right? So muscle sole of foot, that is important. And gluteal region, Trendelenburg sign, that is important over here. Sciatic foramina, what structure passes, what does not pass. Greater, lesser sciatic foramina, understand them. You can take help of few past lectures. And that is your joints and ligaments. Again, the largest joint in the body, knee joint, hip joint, ligaments. Ankle, what do you need to study? Not the anatomy of the joint, but at least ligaments you should know. Inversion, eversion injuries are so common. Mainly inversion injuries there. So what are the lateral ligaments, medial ligaments? Inversion injury, it is the lateral ligament that would be injured. Which lateral ligament? ATFL, remember. Anteatalofibular. Right? Other injuries are there, but ligaments you should be clear. Knee injuries, hip injuries. What less to say? Orthopedics, based on this only. Sole of foot and arches. Arches, at least this arch should be crystal clear. Medial longitudinal arch should be crystal clear. That is my point. Let us see some images. There is a bone over here. Femur, Trendelenburg's over here. Right? Not many images, but yeah, few. Embryology again. Let's finish these topics also. Oogenesis, initial 3 weeks, crystal clear. Oogenesis, the question can drop any time. Pharyngeal arches, very, very important. Head and neck. CVS embryology, I told you in the heart part. GIT, genitourinary embryology. You can look at my few special classes on embryology and you get a good idea of it. This will save your time immensely. CNS embryology, meningocele, anencephaly, so many things are there. Applied importance. Just a couple of images over here showing the somites and all. Pharyngeal arches is over here. Pharyngeal arches again. Aortic arches. Septums. Phase development. Anomalies. Questions, a lot of them. General anatomy. Now last thing over here, general anatomy, that is bone, muscle, ligament and all. I would urge all of you, if you don't have much time, I know you don't have much time, but at least read the types of joint. एक टॉपिक कर लेना जनरल एनाटॉमी से बस, दैट इज एटलीस्ट टाइप्स ऑफ जॉइंट, एटलीस्ट. आई मीन आई एम नॉट सेइंग कि टाइम है तब भी और नहीं पढ़ा, पढ़ लो. व्हाट यू वांट टू स्टडी, बट इन जनरल एनाटॉमी एटलीस्ट गो थ्रू द टाइप्स ऑफ जॉइंट. ये ज़रूर क्लियर होना चाहिए. Then in histology, the last slide over here, few names I have written over here, but histology ऐसी चीज़ है, it is like that daily 10 minutes कहीं पे भी दे दो. When you are feeling बहुत पढ़ लिया, कुछ पढ़ने का मन नहीं कर रहा, not able to sleep, not in a mood to look at a phone or laptop, कुछ करने का मन नहीं है, you are traveling anywhere, 10-15 minutes give to histology. Slides देख लो. For few, if you do this for few days, 15-20 दिन में your topic would be clear. And 1 or 2 questions कभी भी आ सकते हैं यहाँ से. They do come actually, and this will be a benefit. And these questions are crystal clear. मतलब इसमें it's like maths, either you know it or you don't know it. इतना कर लो बस. In 15-20 days clear हो जाएगा. Right? So these are few topics. Now I urge again, write in the comment box few topics which you want. We will make a small sessions for those topics only. ठीक है? So that's all. I hope you enjoyed. Bye bye and all the best. Thank you.